Hi, today is February 19th, and I've just finished number 13 of my ketamine infusions. I'm now at the point of having most of my brain function back now, so I figured I would just post an update and let everybody know where I'm at. Primarily, this is for myself, but I have several people that are following this just as a comparison to where they're at. So, update for everybody. So this last round, we were only able to work in one of the infusions. They're called boosters at this point. Due to the various doctor follow-ups that I had in St. Pete and Clearwater, um, again, just the one infusion was all that we could work in. So I met with my surgeon, jaw surgeon, Dr. Mark Piper, and then I also met with the pain management specialist, Dr. Hannah. So I wanted to update my blog here and speak primarily on the updates from my surgeon, Dr. Piper, and then I'm going to go into a little bit on the ketamine infusion progress. So first with Dr. Piper, it was a 15-month follow-up. So I had my surgery November 2016, met with him in February of this month, obviously, and that marked my 15 months. He was quite pleased with what he saw overall. The TMJ structure itself, it's holding up nicely. With the fat grafts, they're staying in place and they're doing their job. The bone structure, specifically the condyle, is starting to rebuild. So that's the bone that goes right here that builds into the top part of the jaw joint. It's starting to rebuild, and he said that he wants me to continue with the calcium and the vitamin D supplements, and then I'm to follow up in my primary care in a couple months to see if my blood levels are okay and if he feels that I need to continue with the supplements as well. I've made a huge jump in my bite adjustments since he saw me last, thankfully to the great hands of Dr. Henry. Even I'm impressed with what I saw. I'll post a picture of the comparisons later in this post so you'll be able to see. My progress alongside my Krebs therapy and overall progression, they're happy with. And he was very concerned that any further action in my jaw structure and or bite adjustments would only exacerbate the CRPS and may potentially cause a spread beyond my control. I think that's one thing that we were all fearful of. I'm very glad with the decisions that I made in going through with the 2-week ketamine boot camp. So the detailed infusions that they did for the solid 2 weeks, and then followed through with the boosters just after each bite adjustment over the last couple months. It was honestly the thing that alleviated the majority of the pain patterns that we all expected. So every time I had a bite adjustment, I knew that I was going to be having ketamine infusions or having the ketamine blast, and it would hopefully take away the majority of the pain spells that were expected from the Crips, and it worked. With all the good, obviously there was a lot of good parts that Dr. Piper had shared with us as he reviewed my CT scans over and over. But with all good, a little bit of bad has to come, right? Well, while Dr. Piper was thrilled with my overall progression and wants to see me before Dr. Henry decides to take off all this metal in my mouth, he doesn't feel that I'm going to need any bite adjustment surgery. My teeth are lining up perfect. So it's taking off the pressure from my jaw joints. They're lining up perfect, just as he anticipated. He even anticipates the actual teeth up here to have a considerable lineup as well. You'll see in the pictures that I share, there was a sizable gap between my top teeth and my bottom teeth. I know this video is very blurry, but there was a sizable gap right here, and now it's starting to close in, and my teeth are really straight now. And that all is taking off the pressure from my joints. It's allowing my teeth right here to line up as well and be able to grip the way that it needs to grip. So, bite adjustment, not necessary as far as surgical procedure. I was excited to hear this, and it's one additional surgery that I'm not going to have to worry with. And now to the not so good news. I'm going to try to explain this the best that I understood. So, like I said, my bite started to change. All my teeth are moving and adjusting, and my teeth are starting to line up nicely. This is not a cosmetic adjustment. It's not something to make me feel pretty and say, oh, my teeth are all straight and nice. It literally is to take the pressure off my joints. And any unnecessary imbalance is going to cause more pressure on my joints and ultimately cause the fat grafts not to be as well balanced as they need to be and cause additional pressure. So the problem is that my bite continues to adjust as my teeth close in the front space of my mouth. This is making my chin, it's making my chin disappear. It looks like I have a really fat neck now, and my chin, like when I'm standing here normally, I have hardly any chin. That was the way it was for me before, but it's even more pronounced. My profile is practically gone. So he showed that to me on the CT scan and how it's moved back. It's moved back at least 1 centimeter, my chin itself. And that's as the teeth adjust, it's straightening up and it's pushing this back. So that's not good. It's just a big no. I'm not happy with that, but it's kind of where we go. This is how we're moving along. Nothing's gone wrong. Nothing's happening the way that it shouldn't have happened. It's just where we're at now. So the big good thing is that I don't have to have any of my major jaw structure adjusted. That's good. Where I'm at right now is that the chin is ultimately going to have to be moved forward, and that's just by a little slice of the bone, and they move it forward and then they secure it with screws and plates, and then that gives the space in my mouth to allow everything to hang out more. So again, it's not cosmetic. It's not to make my chin look better and to make me not have a fat neck. That's great. The reason why it's important is because I have this huge, large muscle in the middle of my mouth called my tongue, and it's just hanging out in my mouth. It doesn't have enough space because my chin is so far pressed back. As my chin moves forward, my tongue is going to have more room in my mouth. Sitting up, my CT scans were all done sitting up. When he did the roundabout CT scans, he could see my airway, and I'll post a picture of that as well. My airway now is compromised because my tongue has less space because my chin is compressed back. So, is that a problem with me walking around, living and breathing during day to day? Probably not as big of an issue right now, but Dr. Piper told us that we needed to watch for added snoring and apnea related events, primarily when I'm sleeping. This is going to be my biggest clue that it's time to do something about the chin. When could that happen? He primarily is going to be watching for this after all the teeth adjustments have been made. We can't stop on the teeth adjustments because they're necessary in order to make sure everything's secure so the joint stays secure. So we can't stop any of that. But once everything's all shored up, my teeth are all fixed, everything's leveled where they need to be, we're going to take another look at the airway and see if it's even more compromised. His feeling is that the chin is going to compress back even further and press back into my airway. So ultimately, I'm going to have the, I can't remember what it's called, but the chin surgery where they just move it forward. I'm not going to add a piece of chin to me. It's actually cutting this chin and progressing it forward. So Dr. Piper will see me back in 6 to 9 months and determine how I look. The next aha moment that we had with the CT scan was my cervical spine. So when I originally went in for jaw surgery, when I was having the headaches, I had also been having pain in my left shoulder, down through my elbow and down into my wrist. Completely, to me, was completely separate from my jaw, and technically it was. But Dr. Piper was able to see that my C5, C6 were compressed. They weren't touching, but they were compressed. And it was something that I was going to have to look into eventually. Well, now he sees that my C5 and C6 are physically touching each other. Also, my C4, right above it, has a spur that's forming off of it. So he needs me to follow up with a neurosurgeon and figure out next steps with that. I had seen a neurosurgeon before I went in for the jaw surgery, and he had suggested traction versus having any kind of surgical intervention. So I will pursue having the traction done. And the traction is going to be done by a cervical spine, and they'll just pull back onto my neck and separate out the C5, C6. So work on doing that in the next couple months, meeting with the neurosurgeon and figuring out what options we have with that. So this last week, we also met with Dr. Hannah to discuss my progress with the ketamine infusions. I explained to him that I feel great. My energy level has increased tremendously. I actually thrive to exercise now, which is really weird for me because considering that I have a form of muscular dystrophy or a neuropathy, I've always been one to kind of not want to exercise as much as I need to because it hurts in other places. But I actually have a drive and a thrive to exercise. He was excited to hear that. And overall, the pain and the pressure that I've been feeling is just not there to weigh my body down. So that's been exciting for me. I think the other thing that's helped is that I haven't been on the pain medicine. Um, the pain medicine, the Lyrica, all that stuff was weighing my brain down and my overall body. So the general pain levels and pressure in my face, it's reduced about 60 to 70%, which is amazing for me. I can think, I can talk, I can function way clearly, way more clearly than I used to. Um, and like I said, I've been pain medicine free since December 8th, 2016. This whole therapy that I've been going through is not a drug treatment program. It is a program that turns off the central nervous system or a portion of the central nervous system and gives it that period of rest so that it can reset. And that's what it's been doing. So he was excited to hear this and he's ready for me to return to work just as soon as my local pain management doctor is ready for me to, which I anticipate getting the clearance from her this week. So I'm excited about that and getting back to work. He's going to see me back in a month. And we're going to go through round 14 and 15 of my ketamine infusions, which are the boosters, and go on from there. I'm hoping after this next round that I'll be able to push it out about 3 or 6 months before I have to do another infusion booster again. He is supplementing me with the ketamine lozenges. I know that in speaking with Dr. Piper, he was um, rather interested in hearing what these ketamine lozenges are all about. It's very, for me, it's a very, very small dose. I only take 30 milligrams twice a day, once early in the morning before I get my day going, and once later in the afternoon. Um, it, the effects, because the ketamine, like we talked about, the ketamine does kind of just turn your brain off a little bit and then you go on about your day. It's 30 milligrams. It's a super small amount. But for me, it takes me about 20-30 minutes for me to be in a la la land phase. And then you would have no clue that I've taken anything. So it turns that portion of the central nervous system off, allows a little quick reboot, and then I can go on about my day completely pain free for the rest of the day. Because I have a jaw issue, because my crypts is in my jaw, I do have periods where I have pressure. All it is, it feels like somebody's pushing their thumb right here into my eardrum. And then I have pressure right here on my SCM muscle down into my voice box. Um, it is a spasm and it is part of the Crips overall. Um, it, it's not nearly as intense as it used to be. It's just there and it's something that I have to manage. So I do have some muscle relaxers that I can take, very minute, small muscle relaxer that'll help kind of alleviate that. But overall, again, I'm thinking through and clearly executing my life as I need to now. So I, I can't even begin to explain to you how excited I am just to see myself forward. Whereas before I was in this sense of doom and gloom and I don't know how I'm going to be able to manage this. I don't know why I didn't just allow myself to go through the ketamine process a year ago. I was afraid of it. It's considered experimental. There's not much out there. Insurance doesn't support it, um, but it works. For Crips, it works. There's other things that ketamine will support and reduce for you as far as pain levels and other neurological symptoms. Um, it works. I've even seen studies where it works for muscular dystrophy patients as well. people that primarily have the neuropathy of the hands and the feet, and it reduces the inflammation and the pain that goes through the central nervous system, and it gives you that boost. So I can't even begin to keep saying it, but it works. Um, so I'm going to add a couple pictures to this post for documentation. As I've said before, if you've gotten this far and you're following me because you started with that niggling headache that turned into a lightning bolt down your face and nothing's working for you and you're in that depth of despair moment like I was, like I have been, please message me. Let's talk. There are things that you can do. I'm trying to be an advocate for all of the things that I've gone through. Every doctor that I've run into has been an amazing person in my life. They've led me the direction that I needed to go. They have not led me wrong one bit. I didn't trust the process several times, but now that I am trusting, I'm a full believer of it, and it's life changer. I did want to speak a little bit about what this last ketamine booster did to me, I guess, or not for me, but to me. Um, so normally for ketamine boosters, they do them either in the morning, 8 to 12, or in the afternoon, 12 to 4, or excuse me, 12:30 to 4:30. And due to the scheduling, I had to have the afternoon treatment. So they actually got me plugged in about 1 o'clock, and I went to sleep like right away. I don't remember anything past 1:15. Um, Normally I'm plugging in my headset, kind of goofing off, talking to my husband and stuff like that. I do not remember any of that. The other thing that I normally remember is my husband trying to wake me up. He'll usually be in my face or things are really just weird and wild. I usually see him with magnifying glasses with him in my face, but he's this big, but he feels like he's this big. That's the ketamine. But I don't remember any of that. I barely remember him telling me it's over and I need to wake up, but that's it. The other thing that I've always remembered with every infusion is him telling me to kick my feet, move my legs, move my hands, move my arms. And that's just slowly for my body to get waking up and get moving. With their treatment plan with Dr. Hannah, once you're able to get into the wheelchair, they'll wheel you out to your car and your caretaker takes you back to your house or to your hotel room. And you basically crash in your bed and you sleep off the Versed and ketamine for the rest of the afternoon. It takes about 3, 4 hours. For me, I don't remember none of that. And that is the freakiest thing for me ever. I had a zero control, zero knowledge of anything that happened after 1:15 on Thursday afternoon, this past Thursday. Um, from what my husband told me, he said that once they discharged me from the Versed and the ketamine, they were trying to get me to wake up, and it was slow. I wasn't waking up, so they were creating bags of what he thinks maybe were saline or some kind of IV fluids, and pumped at least 2 or 3 more IV bags in me, trying to get me to wake up. It wasn't till about 6 or 6:30 in the evening before I was even in a position to be able to get into a wheelchair. I don't remember any of that. Once they got me in the wheelchair, supposedly they took me to the bathroom to help me take care of that. I don't remember that. And then they put me in the car, buckled me up, and sent me on my way. I don't remember that. My husband usually gets a wheelchair out, gets me in a wheelchair, and takes me up to the hotel. Do not remember any of that. And I don't remember getting in the bed. Really, really, really awkward situation. But I'm just so thankful that I know the nurses. They're awesome. JoJo and Jen specifically are at the top of my head. Um, Amazing nurses in Dr. Hannah's office, and then my amazing husband. If I didn't have the trust and ability to rely on them, this would be a very, very scary situation. But just the bottom line with that is make sure that you know the people that are going to be taking care of you. The nurses you may not know right away or be as aware of them, but you will. They are an amazing set of nurses at Dr. Hannah's office. I can't speak highly of them enough. So I'll close with this. Again, if you have any questions, any issues that you're running into specifically, obviously this blog is for myself to keep track of where I'm going. But if you want to chat, just message below and or email me, and I look forward to hearing from you. Until next time, stay safe, stay strong, stay happy, and just believe that you can get through this. Bye.